we are going to present some information and give you some materials that are designed to help you be able to know a little bit more about Medicare, how it's useful for you, what are some things you need in order to plan for it. And this is a fairly new program for us, so it would be very helpful if you would be willing to fill out our evaluation. The way this works is there are a few questions, and then we'll ask you to, if you're accessing through your computer, to shrink the screen. Jesse, if you have the link available, could you put it in the chat box? And if you don't, I have it, so just let me know.
I'm working on it right now.
Awesome. That's what I figured. So we'll put a link in the chat box. You can access it that way, or you can use the QR code and your phone if your phone is not the device you're participating with, and give you a moment to do that. But don't close it. So there's a couple questions and then we stop. I think there's a stop sign in the poll, and then we'll pick it up at the last few questions at the end. But that really helps us know if this is a helpful program, and also can provide some opportunity to get some feedback from you as a participant. So Jesse has put the link in the chat box. Give it about 30 more seconds and then we'll move on. Actually, while you're doing that, I will put this on the next screen.
And they'll just complete the first page and they can minimize it at that point, or if they click the next button, minimize it after that, because that'll be the post question. So there's not really a stop button on there, but if they answer the questions on the first page and then minimize it and then come back to it at the end of the presentation.
All right, so continuing on, I'm going to put all these up and give you a moment to look them over. This is our plan for today. So as you can see, we're going to, we have 4 different objectives. One is to help you understand what you need to know about health care costs in your senior years. Primarily, we'll be focusing on Medicare, but there's some other information to pass on as well. We'll point you in some good directions to get more information about Medicare. There's a lot to know. We will not be covering everything you need to know about Medicare in this hour, but just knowing where to find the information when you do want an answer to a question is really important too. So we'll give you some reliable resources for that. We will review strategies and tools to help estimate healthcare costs, because as we'll talk about shortly, healthcare costs can be a big portion of a budget at any time in life, but particularly in the senior years. So being able to plan ahead can eliminate some of the stress of planning for it. And then we'll talk about what options there are within these plans to offer long-term, to cover long-term healthcare costs. Those are our primary objectives. We'll answer some key questions, but I'll put them all up there too. And these are the questions we're going to answer while we're here this evening. The why, the what, and the how. Why it's important to plan for healthcare after the age of 65. We'll do the what's, that's really the meat. What is Medicare and what does it cover? What other insurance options are there, and what documents provide this information for you? And then how. How do you incorporate all this information into your financial planning? This health insurance covers, it's important for your health, but it's also important for your finances as well. So we're taking a financial approach to this. So the first question we're going to address is the why. Why do I need to plan for healthcare after the age of 65? So I'm going to see what your thoughts are. What brings you here? Why is it important to you to plan for healthcare after the age of 65? For anyone who's willing, I'd love to hear your thoughts in the chat box. Why is it important to plan for healthcare after the age of 65? Yeah, I see it's a big part of your budget costs, a big expense. Yes, healthcare costs can bankrupt you, absolutely. You no longer have employer paid insurance. That's true for most people. Some do, and we'll address that. That's Venus asked a very common question: will I have enough money? That is a big concern for a lot of people, and that's why it was important for us to do this program. A lot of us worry, will I have enough money when I reach that age to cover my healthcare costs, as well as being able to have the necessities in life to provide for, you know, my housing and my food and things like that, medication. We hear of people having to make choices between the food they buy or the medications they buy. So it's a big concern. And Shelley says there's a lot I don't know. And that's true for a lot of us. Yeah, and we're approaching that. So I think you've hit on a lot of the reasons we'll cover on the next slide. So why do I need to plan for health insurance after the age of 65? There's several reasons. We'll talk, you've hit on a lot. We'll make sure that we're covered them all. So a big reason is to ensure that we have health insurance that we need as we age. As we get older, health insurance becomes a big part of our budget. Medicare becomes a primary insurance for most of us. And when you reach the age of 65, you have a 7-month window in order to sign up for it. So it's important to know before that time comes what to expect, what the costs are going to be, and to make sure that you have it so that you can access healthcare as you need it. Another reason is to gain the most benefit from your insurance coverage. So health insurance ensures that you have the benefits and access to preventative services that you need at a lower cost. Most of the time, the health providers that you see have negotiated costs with the health insurance company. So going to the providers covered under your insurance can help you save money. It ensures that you can get the benefits that you need. Another reason to plan for health insurance is so that you can determine the total out-of-pocket costs of your health insurance plan. So, and this came up a lot in the chat, health costs are a major portion of an individual's or family spending plan. So being able to prepare really helps work those costs into a spending plan ahead of time. Another reason to understand Medicare early is so that you have money to pay for out-of-pocket expenses. Part of that, the previous point, understanding the total cost of the out-of-pocket expenses, is so that you can plan ahead and set aside money in savings or a health savings account in order to pay for those costs, so that you're not worried about whether they can be covered or not. You know that you've had that taken care of, and it's easier to have that knowledge when you have the right Medicare plan for you, because you can plan more easily for what those out-of-pocket costs will be. Another reason is to determine if your health insurance plan fits your financial situation. There are a lot of choices and options with Medicare, and so it's not a one-size-fits-all or a one plan fits all. So a good reason for a program like this is to help you evaluate the plan that you have, or the plan that you might want to have when the time comes. I think I just went too far. Nope. Sorry about that. All right, so now we're going to go into the what. What is Medicare and what does it cover? I'm guessing that's why most of you are here this evening. I do have one more poll. Something else that I'm curious about. Let me drop it. So I'm curious for you at home. There we go. How many are with you this evening? Are you attending this workshop on your own? Are you with a spouse or significant other or a family member? You and all your best friends watching a Medicare program together? All right, I'm going to end this. Some of you are with someone else. Most of you are watching this on your own. Okay, thank you. That just gives me a good idea of who's out there in virtual land. So what is Medicare? And what does it cover? So in short, Medicare is a national health insurance program. We've had it in the United States for over 50 years, and it's administered under the Social Security Administration, the Centers for Medicare and Medicaid Services. So it provides health insurance primarily for Americans who are age 65 and older, but there are some other qualifications. There are certain disability exceptions. People with certain disabilities are eligible to have their health insurance through Medicaid, and certain people under certain retirement disability programs. So there are some exceptions to that, but it's primarily a health insurance program for people who are age 65 and older. So what does Medicare cover? There are 4 parts of Medicare, and then there are some other programs that go along with it, some Medigap programs, and we will go into those. And what's a little confusing is they're all labeled by letter. The letters don't necessarily mean anything in particular, but Medicare itself has 4 parts, A, B, C, and D, as you can see on your screen. So Part A covers inpatient and hospital coverage. Part B provides outpatient medical coverage, which is things like your doctor visits, your outpatient and your diagnostic screenings, things like that, so outpatient care. Part C resembles, if you have insurance through an employer now, Part C is an alternative Medicare coverage that resembles more or less what your standard employer-based healthcare might look like. We'll talk about that in a little bit more detail. That's another term for that is Medicare Advantage. These are offered through private insurance companies. When you join a Medicare Advantage plan, you still have Medicare. It's still a Medicare program, but it often includes the other parts along with it. It often includes, it does include the Part A, the Part B, and often the Part D, which we'll get to, which is the drug coverage. Part D, conveniently, D for drug. That's just happens to be that way. So Part D is prescription drug coverage, and that is separate. So the Part D is only offered through private health plans. So you purchase these or sign up for these separately. I'm going to play a little video. Hopefully it'll play. This will shed a little bit of light. Here we go.
Hi, I'm Angela James at the Centers for Medicare and Medicaid Services. Did you know that you can choose how you get your Medicare coverage? Today we're going to talk about the differences between original Medicare, Medicare Advantage and prescription drug plans, and Medicare supplement insurance policies, which are also known as Medigap policies. When you're eligible for Medicare, the first thing to consider is whether you want to get your coverage through original Medicare or a Medicare Advantage plan like an HMO or PPO. Both original Medicare and Medicare Advantage plans have both Part A and Part B coverage. Part A covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Part A is free for most people. Now, Part B covers certain doctor services, outpatient care, medical supplies, and preventive services. There's a monthly premium for Part B. Now, even though both original Medicare and Medicare Advantage plans cover Part A and Part B services, there are some differences that I want to help you understand. Original Medicare is provided directly through Medicare, and you have your choice of doctors, hospitals, and other providers that accept Medicare. Original Medicare covers about 80% of your healthcare costs. Generally, you or any supplemental coverage that you have pays deductibles and coinsurance, and you usually pay a monthly Part B premium. Now, Medicare Advantage plans, also called Part C, provide coverage through private insurance companies that are approved by Medicare. In most plans, you need to use doctors, hospitals, and other providers that are in your plan's provider network. If you decide to use a provider outside of your plan's provider network, you may have to pay more or pay all of the costs. And there are usually co-payments or co-insurance for covered services. And you may pay a monthly premium in addition to your Part B premium. Now, each plan has different costs and rules, and some can have extra coverage like vision or dental. Now I want to tell you about Medicare prescription drug plans, also called Part D. These are plans that add drug coverage to Medicare. These plans are run by private insurance companies that are approved by Medicare. To add this coverage, you usually pay a monthly premium. If you have a Medicare Advantage plan that offers drug coverage, you may have to get that drug coverage through your Medicare Advantage plan. Otherwise, you can join a Medicare prescription drug plan. So do you remember how I told you that Medicare pays about 80% of your healthcare costs? Well, Medicare supplemental insurance policies, or Medigap, is coverage that's offered through private companies to fill in the gaps in original Medicare. With a Medigap plan, you pay a monthly premium in addition to your Part B premium, and the cost for that premium can vary between policies and companies. You may also be able to get similar coverage through an employer or a union. It's important that you realize Medigap policies don't work with Medicare Advantage plans. In fact, if you already have a Medicare Advantage plan, it's illegal for someone to sell you a Medigap policy. Now, these are just the basics. To get more information about your Medicare choices, visit Medicare.gov. And you can also check out some of our other videos on this YouTube channel to learn more.
Okay, so that was just a little short video put out by Medicare that kind of gave a real good short explanation of the different types of coverage, what some of the costs are, and then what the relationship between Medigap coverages and regular Medicare. So what does Medicare cover? This chart can be very helpful. For Part A, most people, and I sent by email a chart that says, and we'll get to that, Medicare coverage, there we go, Medicare costs at a glance. So we will talk about that, and this will help. This is just a little bit of that chart. But it highlights some of the basic pieces of information that are important to know. So the Part A premium, most people don't pay a premium for Part A, and that is the hospitalization. If you do pay for Part A, it's $458 per month in 2020. If you don't sign up for Medicare Part A, then there's a penalty. If you don't sign up in the window of time that you're supposed to sign up for, that's 3 months prior to your 65th birthday, or the month, or the 3 months after, that 7-month window, there can be a penalty. There's some exceptions. I'm actually going to share something. I'm going to share this, but in the document. Let's see. Here we go. So this is that document, but I'm going to scroll down a little bit. And this was sent by email, so if you don't have it now, you can look at it more closely when this is over. So this gives some breakdown of costs. On the Medicare Part A, for most people, there's no cost for it. But there is a 20% out-of-pocket cost. There are also limits to the hospital stays. On Part B, there is a premium based on income. It's an income-based premium. There are deductibles for that as well. Part C, which was described in the video, that varies by plan. And one of the resources we'll share with you is the Medicare.gov, and the plans that are available for Part C vary by state and location. And then Medicare Part D, the drug plan. Now I'm going to scroll down. This is several pages long. It'll tell you what some of the income limits are for costs, who qualifies for what discounts. Still scroll, there we go. Toward the end of this document, you'll see some late enrollment penalties. And this will explain why it's important to enroll for the parts of your Medicare plan on time, because it can be very expensive to delay your enrollment for Medicare. And there are some exceptions to the enrollment periods. I think we have a screen with important dates. I'll wait till we get there. There is a question, what is durable medical equipment? Durable medical equipment are things like crutches, wheelchairs. I'm sure there's quite an extensive list, but things like that. I believe the equipment that you need for oxygen is included, but not the oxygen itself. It can be quite detailed. Medical equipment. It might mean a specialty bed if that's necessary. Oh, I need to go back to one moment. Okay, so these are the important dates to know. The initial enrollment period is 3 months before, 3 months after, and the month of 61st birthday. October 1st of each year, Medicare provides updates for the new plan year. So you can start looking at that date on what changes there might be, what new options there might be, if there's an option that's been changed or it may be taken away. And every year there's an open enrollment period from October the 15th through December the 7th. So during that time, you can make changes to your Medicare or your prescription drug coverage. And the new coverage begins each year on January 1st. There are some exceptions to that timetable. So there's a special enrollment period. For example, if you are employed when you're 65 and you have an employer-based plan, you do not need to sign up for Medicare unless your employer requires it. Some employers will require you to sign up for Medicare, and that becomes your coverage. So that can be employer dependent. But for those of you who are covered under an employer plan or some other plan, you have 8 months from the time that plan ends or your employment ends to sign up for Medicare. So for those already on insurance through an employer, they are eligible for a special enrollment period. So let's talk about Medicare Part C, which is the Medicare Advantage plans. As mentioned in the video, they're like HMOs or PPOs. They're very much like employer-based plans. They include all of the benefits and services that are included under Part A and Part B. That's the requirement. They might include a prescription drug plan. You might pay extra for it. But they often have a limit on your yearly out-of-pocket costs. One thing we have not discussed yet is that Medicare itself does not have, Medicare Part A, Medicare Part B does not have a limit on out-of-pocket costs. So there are deductibles, but there is no limit to the out-of-pocket costs, which is where the Medigap coverage policies come into play. So now we'll talk about those other options. Since Medicare doesn't cover everything, for example, deductibles. If you have employer-based coverage now, chances are you have certain deductibles you need to pay, and you have certain co-insurances you need to pay, often 10 to 30% of the cost of care, but there's often a limit for your out-of-pocket costs for the year. Your out-of-pocket cost limit can often range. Sometimes it's as low as a few $100s, sometimes it's as high as $5,000 or $10,000, but there's a limit to out-of-pocket costs. That is not the case with Medicare Part A and Part B. And that then becomes the reason to look into some Medigap or supplemental policies. So we'll talk a little bit about what those Medigap and supplemental policies cover. So they're designed to wrap around and supplement the Medicare policies. The type that you get depends on really what your needs are and what your plans are. One of the documents that I emailed to you was a chart that looks like this. So you'll have additional time to look this over, but as you can see from the chart, and maybe what I'll do is I'll pull this up separately too. So you should see the Medicare, the Medigap policy comparison chart. Is that what you see on your screen?
Yes, that's what we see.
Great, okay. Want to stop share for a moment. So this chart, and this was sent by email, helps compare the different supplemental Medicare policies, and they are very creatively named: A, B, C, D, F, G, K, L, M, N. Part of the reason for the gap is I believe there had been some other policies that were discontinued in the middle. So these are policies that you pay for separately. They're separate policies. They are designed to supplement the Medicare policy that you have. They are not required, but the whole point of insurance is to lower your risk. So you pay for these policies, but it lowers your risk, your financial risk, by signing up for one of these. They all help cover the co-insurance and additional hospital costs to supplement Medicare Part A coverage. As I mentioned before, there's no limit to the dollar amount of deductible that you pay for your Part A insurance. So these all provide a supplement and additional hospitalization to go with your Medicare Part A. As you can see from the next line, this is where some of the changes start to occur. So Part B, which is your outpatient care part of Medicare, some of them, ones that say yes, will, you can see down in the left column what it's for, kind of broken by the page divider there. So Part B, your co-insurance or co-payment premium, some of these, Medigap policy A, B, C, D, F, G, and M, and to some degree N, all help you pay the co-insurance for Part B. And a couple of these I'll pay a fraction. As I said, we're not going to go through every line, but these just show different services and how the different Medigap policies may or may not help cover some of those. I'm going to go on down. One of the items that could be covered, for example, is foreign travel. So you often are not covered for health insurance if you travel abroad, but some of these supplemental policies will cover up to 80% for foreign travel. So that's something to look into if you do travel abroad frequently. So this is just a glance over, not with a whole lot of detail, but a chart that helps you at a glance compare what the different Medigap coverages, Medigap policies cover. So are there any questions at this point from anything that we've covered? If you think of something, put it in the chat box, but with this, I will turn the rest of the presentation over to my colleague, Jessie.
Thank you, Dorothy. And give me a second to switch things over.
Sure, we can do that. And there we go.
And I just need to pull it up here. All right, so it's like I'm on the wrong screen, doesn't it? Okay, so Dorothy, just want to confirm where we need to be. that everyone's seeing what I'm seeing?
Yep.
Okay, good, good. So now we're going to look at what the key question of what documents provide information about your costs that go along with healthcare, and what documents you need to assist you through this process. So the first thing, of course, is your health insurance card. And so again, we have two different examples up there. If you have a private-based health insurance plan right now, you're probably going to have something similar to what's on the right there, and you're going to see it's going to have information. It's your proof of insurance, so it's going to have your group number, your name, your member number, your effective date. It should have a number on there to call if you have any questions. Sometimes it's going to have information about copays and prescriptions. And then the example on the left is your Medicare card. Again, all of this is important information that you need to carry with you when you go to a medical appointment, because they're going to ask for this information. So again, that's an important document that you have to have with you. You're going to need your evidence of coverage. This is something that you can refer to. And essentially the evidence of coverage is a contract between the insurance company and you. And so it provides you all the information about the plan that you're signed up for. Now, some insurance companies will give you something in writing. Others will have that information on a website. When it comes specifically to Medicare, you're going to have to go to the website to find information. So Medicare does have a wonderful website. It provides a lot of great information, but they're not going to necessarily send you what we consider a traditional evidence of coverage booklet. So now let's look at how do we estimate healthcare costs. And to do that, we're going to introduce you to Terry's family, and you should have received this in your handout information. So this is our case study that goes along with this module, and we're going to walk through it and provide you some information to help you in terms of estimating your cost when it comes to Medicare. So here you have the Terry family. You have Terry, who's 68, and Drew, who's 67. They are a couple on the go, relatively healthy. They both have Medicare, prescription drug, and supplemental medical policy, Medigap coverage. After reviewing healthcare expenses and explanation of benefits documents from last year, Terry noticed that there is an individual deductible for Part A of $1,340 and for Part B of $366. If you combine those two figures, you're going to get 1,706, and you're going to multiply that by 2 because each one of them is paying for that individually. So because of the Medicare Supplemental F policy, the only additional out-of-pocket expense would be for co-payments for their medical cost. And so some additional pieces of information for our case study. Each family member visited their primary care physician 4 times. They pay a $20 copayment to see the doctor in each visit. Terry determined they paid 8 copayments for 8 visits. Drew has allergies and visits an allergy specialist once a year and has prescription drugs to help them manage allergies. And Drew pays $30 for an office visit once a year and $15 for a prescription, which is a 90-day supply 4 times a year. Terry and Drew wear glasses and go to the optometrist once a year for a checkup, and each get new glasses. The vision copayment is $30, and the glasses cost $300 each. Terry and Drew each go to the dentist once a year with a copayment of $30. Terry pays a total of $268 a month for Medicare Part B premiums, $70, so the 35 times 2 a month for prescription drug coverage, and lastly $380 a month, which is 2 times 160 for Medicare Supplemental Type F policy. Terry also pays $80 a month for dental insurance premiums. So those are the important numbers that you need to know. And again, if you have that case study, printed, it would be helpful for you to have this page out, but we're going to walk through it. So in the case study, you have a blank document. I'm going to switch over to the next page with the answers so that we can walk through it. We're kind of doing this as a group activity in person. We would kind of work through this before I would show you the answers. But in this case, I'm going to just go straight to the answers for you. So you can see as you walk through this, and again, if you have the narrative in front of you, you can find it. But you had the dental insurance premium, which cost $80. You had the prescription insurance premium, which costs $70. You have your Medicare premium, which is $268. And you have that Medicare supplemental insurance policy of $380. Those again are monthly fixed costs, and so that means you had the same payment every month, and so your total monthly fixed cost is $798. And if you have any questions along the way, please let us know, and we'll answer the questions. And so then you look at, you multiply that 798 figure by 12, and that's going to give you $9,576 as a total annual fixed healthcare cost. So you need to know that you're going to have that much money set aside automatically. In this case, because we have the supplemental plan, there's no annual deductible, and we don't have an out-of-pocket maximum, so that doesn't apply. Then as you went through the case study with each of the bullet points, you're going to come up with some numbers. So the regular office visits, there's 8, $20 for each. That gives you a total of $160. The specialist, there's 1 visit with a $30 copayment, so that's $30. When it comes to prescriptions, you're going to have to fill that prescription 4 times a year at $15 a piece. That gives you $60. And you have your dental preventive visits. You have 2 of those at $30 a piece. There's $60 there. Your vision exam payments, 2 of those at $30. That gives you a total of $60. And then when they both bought glasses, so $300 for each of the glasses takes you to $600. So their total flexible healthcare costs are $970. And the question there is, how do you plan for emergencies? And so that's kind of a larger question when it comes to thinking about finances in terms of setting aside money for emergencies. And when you're looking at that, you do want to look at, a good 3 to 6 months of money set aside for emergencies. And so you always got to think financially how your insurance plays into your finances as a whole. So in the case study, we switch over to some other calculations. And so how do we estimate those monthly, annual, and out-of-pocket costs? So we have some things. We got to look at our annual deductible, our total fixed healthcare expenses. That gives us our total known cost. Take the total known cost divided by 12s, and then you got to come up with that monthly amount to save above the premium. And so when you look at those figures, and you could pull them from that first page, everything kind of transfers over. It's also color coded, so you should be able to do it from that perspective as well. We don't have an annual deductible, as you can see. The total flexible healthcare cost are $970, and that gives us a total known cost of $970. And then you have your total annual known cost now, $970. You divide that by 12, and that gives you about $81. I think it's $80.83 exactly, but 81, just keep it a simple number. And so you need to have that money set aside. And then what are your total annual healthcare costs? Well, you take the $9,576, which is your total annual fixed healthcare cost, add to your total known cost. And so your total annual out-of-pocket cost would be $10,000. $546. And so that's what you got to make sure that you have set aside each year when you look at this particular scenario. And so you should be thinking about that as you go into each plan year. How much money do you need to set aside? And the best way to kind of start to do that is to look how you spent your cost in the past, how often you went to the doctor, how often you fill prescriptions. You can use that past information to determine what your costs may be in the future. So when it comes to managing your healthcare costs, what are some tips that we can give you? One, you need to review your health insurance documents and understand your plan and its cost. And again, sometimes what happens is you look at you're enrolled in a plan, and then you realize, okay, maybe this isn't the best plan for me given how I use my insurance, and so I may need to select a different plan based on that particular situation, or I may need that Medigap coverage to help cover my cost. You do need to estimate your co-payments, prescriptions, equipment, travel, and other costs. Again, you do need to be prepared for those costs on a yearly basis. In doing that, you can calculate how much you set aside to cover your out-of-pocket cost. And then when you've pulled together all this information, you can shop around for supplemental drug insurance plans each year to make sure you have the information you need. And so the question was asked here in the chat, how will these sheets be provided after the session? Everyone should have received the case study as part of the materials they received before the session. But if not, we will send something out as well.
I'll reattach everything just in case there are people that signed up after these were emailed out. For everyone who's in attendance, I will resend this case study as well as the other documents that we talked about, plus a small booklet from Medicare itself. So that those will all be sent out afterwards.
And the question about hearing aids, I'm not sure what I think it's going to depend upon what type of plan you're enrolled in as to whether hearing aids are covered and to the extent they're covered. So you're going to have to look at your individual plan about that. And anytime you have a question about your plan, look for that contact information for the insurance company and call them and ask them. They will be able to provide you some direction in terms of cost as well. So now let's jump over to long-term care and how do you cover long-term care, and try to answer that question a little bit. So what is long-term care? Long-term care is a range of services and support for your personal care needs. Most long-term care is not medical care. So again, you got to keep that difference. It's not medical care. Instead, most long-term care is help with personal tasks of everyday life, sometimes called activities of daily living, but it's also called custodial care. And that's the term you're going to hear within the field, is custodial care. So Medicare does not cover long-term custodial care. And that's important to know too. So what does Medicare cover? So Medicare does cover long-term care in a hospital. So usually more one serious condition for patients who may improve over time and return home. So they're looking at this is a temporary situation where they're going to end up returning home. It does cover skilled care and nursing, or skilled nursing care in a skilled nursing facility. And so Medicare Part E covers skilled nursing care provided in a skilled nursing facility under certain conditions for a limited period of time. So it is time limited. Medicare does cover eligible home health services, and so it's going to cover things like intermediate skilled nursing care, physical therapy, speech language pathology services, continued occupational services, and more. So again, it's limited. It's not unlimited. It is limited with the understanding that there's going to be improvement and the person is going to go back to living independently. And it does cover hospice or respite care. So this is usually given at home, but it also covers in a hospice inpatient facility. So then, what are your long-term care options, right? And so you have to look at Medicare and Medigap supplemental insurance policies, which cover skilled care. And then long-term care insurance, which is based on the ability to perform activities of daily living. And they usually pay up to a certain amount each day. So the question is there a limit to long-term care coverage? And when you look at like long-term care insurance, you've got to look and see what that insurance covers, because there are different types of long-term care policies. And so as this bullet point says, they may cover a portion, and they may only cover that portion for a period of time. When long-term care was first introduced to the market, those plans, covered, almost all of the cost. And what they found is that, long-term care coverage is very expensive. And so there's been changes to the long-term care insurance. And so you got to make sure that you have that care that you need, and again, is within your financial means. There are some situations where life insurance policies have built-in long-term care coverage. And, what else, it is expected that you will use your assets to cover your long-term care options. And so that's one thing, if you have a house, if you end up in a nursing facility, that house may be used to cover your long-term care. And then there's other programs, Medicaid and other state programs to people with limited income. And so you may end up in a situation where you don't have any assets. In that case, there's a process in which Medicaid would kick in to cover your long-term care. So where do you find information about Medicare and supplemental plans? You can go to medicare.gov. Information. If you have a supplemental policy, you can go to that provider and search up information. You can go to your prescription drug plan and call that number, that provider. Every state has what they call a senior health insurance program, and there's a website on the screen there. Maybe Dorothy can type it in for us into the chat. But there are resources. So, in Maryland, there is a SHIP representative in every county. Of course, some counties, larger counties, are going to have more than one SHIP representative. But that is the expert on Medicare. And so that's where you would go with all your questions. And they, some of those questions in terms of trying to determine what's best for my situation, that is someone that you can go to and talk about your individual situations. So Medicaid is another resource that you can look at, talk to your Medicaid office to see if you meet the income qualifications. And then the government also has a long-term care website that you can visit for more information about long-term care. And you can see the site there. Maybe I can give Dorothy a minute and she can type that site into the chat box as well.
On it.
And as we transition that, we are going to open it up to any questions. So if someone has a question, feel free to type that into the chat box and we'll do our best to answer questions. Someone said it's a lot to digest. Yes, and so as we mentioned, Dorothy is going to send out the PowerPoint to everyone, and she'll include the case study and some of the other materials that we shared with you today. That way you'll have all the information that you need. And I'll just reinforce that SHIP representative there, the Senior Health Insurance Program. They are there to answer questions that you may have. And they're also aware of the regulations and the options of what's in your state. Because I noticed that there were a couple people with us today that are from other states.
Hey, Jesse, while we're doing questions, you want to go give them the survey link real quick?
Yes, and so we need you to go back. If you minimize that window, please open it back up and click on the arrow page and click to the next arrow. If not, I'm going to send the evaluation back out one more time here. Give me a second. And you can just, so if you're going back into this page, just remember that the first page of questions, they are pre-questions. So, don't answer those questions. You can answer the demographic questions, but then click next, and then you'll get the end of program evaluation questions. But hopefully most of you answered the first page, and now you're just answering the post-evaluation questions. And you can see the post-evaluation questions are up on the screen now. So as of right now, how confident are you? 2 questions there. And as of right now, how likely are you? And there are a couple other demographic questions.
There were a few questions in the chat about long-term care, and I'll just reiterate what Jesse had said. The best resource for more specific care, it can be so individualized. So what you're eligible for can depend on your policy. What policy you choose might depend on your income and your needs. But I would start with the SHIP office in your county or your state, as Jesse had mentioned. And then they can refer you. They don't actually sell the policies, but they can be a great resource on making sure that you connect with a trusted resource, to connect with someone who provides those policies, and you can ask those more specific questions. So there's not necessarily one single answer to answer the question of how many weeks are you covered, or for example, that can really depend on what insurance coverage you choose.
And so on the screens are contact information. You can feel free to email either one of us, jketterm@umd.edu and dknuckles@umd.edu. And you should have Dorothy's email because she sent you some information after you registered.
I'll have it again later when I send it out again.
And again, we thank you for joining us today for understanding and estimating healthcare costs in your senior years, Medicare, and long-term care considerations.
Thanks, everyone. Have a great evening. Let us know if any questions come up.